reform proposals seek to provide affordable health care for as many Americans as possible, and most of those plans focus on prevention and primary care. And there's three things that are accentuated in all of those programs. One is that they want to ensure access to care. Two, improve quality and overall health. And three, achieve measurable cost savings within the system. As a reform discussion moves forward, you must remember that just by covering people does not guarantee access. All of those newly insured people will need a medical home, and community health centers will be a vital component of improving, increasing access to the healthcare services in West Virginia. So specifically, the things that we are working with Senator Rockefeller and those at the national level to assure is that in any of the bills that they fund the additional support for the National Health Service Corps program, which is the program that puts providers into medically underserved communities. It would increase it from an existing 400,000 providers to 21,000 providers by 2014. The expansion of Medicaid, which is as indicated, the House bill is at 100, and one of the Senate bills is at 133%. Senate Finance Committee expands Medicaid to 150% of the federal poverty level. And three, the emphasis on prevention. That is one of the hallmarks of the Community Health Center program, is that there is care coordination and management that helps people with chronic conditions manage those diseases and will help to prevent as many unnecessary hospitalizations. So in a nutshell, I hope that that shares with you some of the potential solutions to a significant concern.
Thank you, Louise. Let's give a nice round of applause for that, because I think this sets the tone a little bit on what we disagree with, because if we all agree about 75%, let's get into a discussion on how we disagree on some issues.
George, the AFL-CIO has taken a clear position. There's many areas of healthcare that need to be repaired, but if we're going to drive down costs, the public plan option is the only mechanism to truly drive down costs, and we do support legislation that contains a public plan option.
George, as with Larry, we have many things that we would like to see accomplished and many things that we believe in, but to try to focus on one single, I would say that the idea of portability makes a whole lot of sense to us, and it's something that we can easily support.
Okay. Reverend Patterson?
I would support the public option, and the second thing would be to the Medicaid portion. I heard the 150% would be something that we would support.
I too would support the Medicaid expansion, but I would move up its implementation. Most people don't realize that most of the reforms, and Medicaid expansion being one of them, doesn't happen until either 2013 or 2014 in the House and Senate bill, and I would move that up much more rapidly and get that implemented much sooner.
Fred?
Well, I'm not surprised I have it in here, but the one provision that we would see that needs to come out of this is a public plan option, and I just a little bit of explanation there. The current group-sponsored, employer-sponsored system in West Virginia, approximately $2,000 in annual family premium is attributable to underfunding of the current government programs. Adding an additional public option, paying at Medicare-style rates or anything other than purely market negotiated rates is just going to add to and exacerbate that problem of additional cost on the private healthcare system. And we think with the insurance reforms we've agreed to and getting everybody into the system, that a public plan is not necessary.
Gaylene?
Well, again, I think protecting Medicare as well as eliminating waste in the system, making sure that beneficiaries understand that just because we want to strengthen Medicare doesn't mean that there aren't ways that we can reduce the cost of Medicare. Things like overbilling, duplication of services, unnecessary testing, those sorts of things can reduce the cost of Medicare and keep it strong for our beneficiaries in the future.
Thank you, Gaylene. Louise?
I would also support the expansion of Medicaid, since 25% of our patients are served by Medicaid. That expansion would equate to a significant increase in the number of patients who receive care, as well as some of the unique attributes of both the House and the Senate bill, which provide a cost-based reimbursement for community health centers. And by doing that, that will allow those health centers to provide the comprehensive care that is not necessarily associated with full primary care visits.
Great. Well, let's get to your questions. The first one, and maybe I direct this at Perry and Fred. What is your opinion of an all-payer system in which all payers, Medicare, Medicaid, private insurers, and businesses negotiate a common fee schedule with providers?
I've actually thought if there's, the public option there's good data that it will drive down cost of healthcare. An alternative that's been suggested by Karen Davis of the Commonwealth Fund is to pool the public monies and the private monies together, Blue Cross Blue Shield and PEIA and Medicaid, and then begin to negotiate with providers, hospitals, and doctors on a global basis. And I thought for a long time that if there's anything that other than a public option that will drive down healthcare costs, it is to subject the healthcare industry to real budgets and make them make the hard decisions that public education and others have to make on an everyday basis. So that's a proposal I think has an awful lot of merit.
Fred?
It's an interesting concept, and it's one that's actually worked for quite some time in the state of Maryland. Maryland actually has that all-payer system right now. West Virginia sort of tried to base the system off that. Unfortunately, when they built it, they only made it applicable to the private payers. All the public payers are not subject to that type of a rate regulation, which means you've ended up in a situation where, on average, the program, the public coverage in West Virginia pay about 82% of a hospital's cost, where the private payers pay on average about 135% of a hospital's cost. So I think it's one of those that is worthy of debate. I mean, clearly there's a private insurance system that works and works well in the state of Maryland. There's the Blue Cross Blue Shield plan, the not-for-profit Blue Cross Blue Shield plan, I might add, in the state of Maryland that works very well, as well as other for-profit private carriers that compete well. I think it's a model worth debate discussion.
This one was more of a statement. I'll get to this and I'll ask the question. How can it be that an 18-year-old flipping burgers at McDonald's in Toronto has better health insurance than probably everyone sitting on the stage? Why do we deny the obvious? Our health insurance system is a mess and needs to be fixed. More of a statement, I think, than a question. Gaylene, we've heard that reports from President Obama that he wants to use savings from Medicare to help fund healthcare reform. Does that scare the AARP?
Well, again, I think it has the idea that you can have cuts in Medicare that don't equate to cuts in benefit is a little scary. As I said, I think it's important that we eliminate waste in the system. I think we can all agree that there is waste in the system. Cracking down on those who abuse the system and fraudulently bill Medicare. The duplicate tests and paperwork that I mentioned, as well as preventing unnecessary hospital readmissions, which cost Medicare in the long run, so that we can have older Americans transition safely from a hospital stay to their homes is important. So again, I think eliminating waste in the system is something that needs to be looked at, and I think we can all agree to that.
Reverend Patterson, I would think that one of your main concerns is obviously within the healthcare reform is disparity among minorities. Can you talk a little bit about disparities within the healthcare system and how you'd like to see that implemented in healthcare reform?
Well, I think some of the things that I alluded to happens right here in West Virginia, but disparities have a cost to them, and that's one of the things that we don't talk much about.